Will the clerk call the special actions?
110751, resolution honoring the City of Kansas City, Missouri Health Department and the Federal Executive Board recognition of the National Association of County and City Health Officials for their closed mass prophylaxis dispensing for the federal workforce and collaborative practice plan designation as a model practice. Dr. Rex Archer is here to receive the resolution.
Councilman Sharp.
Thank you very much, Madam Mayor Pro Tem. It's with great pleasure that I introduce this resolution along with many of my colleagues today to recognize the Health Department and the Federal Executive Board for their recognition by the National Association of County and City Health Officials for the mutual aid agreement they worked out to provide medications in case of an outbreak or potential outbreak of a disease that could threaten many of our citizens. I think sometimes we forget that the Health Department is one of our key public safety agencies, and besides their routine duties, they also have the responsibility to protect us from any outbreaks that could endanger many of our citizens. And it's great to see this kind of collaborative effort with the Federal Executive Board and this kind of cooperative plan that now has been recognized as a model practice plan for the nation. So it was my pleasure to introduce this, and I'm glad that they're here today to accept it along with a representative of the Federal Executive Board.
Thank you.
Thank you.
Oh, yes. I want to thank you for your kind words, Councilman, in particular understanding that there's 100,000 federal employees and dependents in the Kansas City metro area, and that this is the first place in the country that this has been done. And Commander Rider will briefly talk a little bit about how that's moving forward in the rest of the nation. I really do want to thank, though, staff member Bonnie Martin, who is Emergency Preparedness Coordinator at our Health Department, funded out of a federal grant. She would be here, but she's actually up at the airport planning for the potential of a dirty bomb exposure and an exercise around that kind of an event. So she's up there working on that. Two quotes come to mind. The only thing harder than preparing for a disaster is explaining why you didn't. And the second one is those who don't learn from history are doomed to repeat it. It was interesting, 10 years ago, I was here in the chamber last Wednesday in August. This was 13 days before 9/11, and I'm doing a presentation on civilian biodefense, what we needed to be doing, where we were going as a city, some of the things I was working on at the national level. I had been down with CDC a year earlier developing their first strategic plan to deal with biological and chemical terrorism. If you remember, after the 9/11 attacks in October, it was actually October 3rd that I was in D.C. testifying in front of the Subcommittee for Appropriations for Health, Labor, and Education on the need for more of these kinds of dollars. And there were 4 senators in the panel testifying to the Appropriations Committee. That next day, the anthrax case from Florida hit on 10/4. Then the media in New York was attacked, and the Senate and other congressional leaders were attacked. We still don't know who did that. Many of the scientists that were part of the biological weapons program in the former Soviet Union are still not accounted for. I will recommend to everybody, if you've not seen the movie Contagion that was just released here on September 9th, both as an individual but also as anyone concerned about protecting our citizens' health, you need to see the movie. When CDC was asked to respond to the question, could this really happen, CDC was compelled to say, and I quote, "Not only could it happen, but CDC scientists are working 24/7 to find out whether it is happening right now." This is the nature of these kinds of events. In Kansas City, I can tell you that over the last 10 years, we're at least 10 times smarter and better prepared intellectually and with plans of what we need to do, and with our federal partners have better systems in place. Unfortunately, I also have to tell you that over the last 2 or 3 years, because of federal and state cutbacks, we actually have less people to do it. And so we are crossing a line where I have to say I don't think we're as prepared as we were 2 or 3 years ago to protect our citizens. So this is something we're all in together on. Commander Rider?
Thank you, sir. Council members, I'll be brief. There's 2 things that I want to speak of. One, to show our appreciation, the Federal Executive Board and the Department of Health and Human Services being allowed to participate in this endeavor. And then 2, to echo Dr. Archer's statement, the nation is looking at what this product is, and many, many other state and city officials are asking questions about what you have spearheaded. So I thank you very much for allowing us to be a part of this.
Madam Mayor Pro Tem, I think we also need to vote on the resolution.
Well, we do, don't we? The resolution is before the council. All in favor?
Thank you.
Say aye. Aye. Opposed? Hearing none. The resolution has been passed.
Aye.
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 Your vote was counted.
So much for coming, Commander. Appreciate it. Doctor, thanks so much.